My name is Dan Bomas. I have been a patient here at Utah Body and Soul. And let me tell you how I got here. I wound up with a pretty ugly infection in my right foot, which should not have surprised me because I'm diabetic. But one of the things that hyperbaric medicine is good for is helping diabetic patients to heal, especially difficult wounds. And I'm happy to be standing here in front of you with both my feet intact now. And let me tell you a little bit about how that happened with the help of Dr. Deanne Long, who is the owner and proprietor here and the physician here at Utah Body and Soul.
Well, our whole goal in hyperbaric medicine and wound care, and they go along hand in hand, you can't do one without the other, is to save the limb. Because anytime you do a small surgery on a limb of a diabetic, that risk goes up because there's chances of infection, chances of greater injury, and then more amputated tissue, and then more infection and more injury and more amputated tissue. And the 5-year survival for diabetics who have one amputation is pretty dismal. It just is, I think, 30% higher once a diabetic has one amputation, that they'll end up having another, or perhaps not even living 5 more years.
Well, with that happy thought, let's take a look at how hyperbaric oxygen treatment actually works. Normally, red blood cells carry oxygen through the body. The hyperbaric, that means high pressure environment inside the chamber, allows oxygen to dissolve in the blood plasma as well, carrying more oxygen to the damaged tissue than red blood cells could do by themselves. Inside the chamber, the pressure is set at 2 atmospheres, twice what we normally experience. So, after changing into clean cotton scrubs, in we go. Here is the control panel for the Sigma hyperbaric chambers, which are state-of-the-art, the newest in the industry. It includes dials that show what pressure it's set for and the actual pressure inside. There are controls for emergency decompression, and there's an intercom to talk with the patient inside. The operator picks up the handset to talk to you, but he or she can always hear you from the inside. That became important once when I had a sinus problem. The pressure in the chamber was causing some pain, so I asked them to take me out, which they did right away. Oxygen is always passing through the chamber, even though the pressure is higher than the surrounding room. Oxygen comes in through the ports in the door and leaves through ports on the other end. It's vented outside through some sophisticated plumbing. Speaking of which, here's where the oxygen comes from. These big cylinders are filled with liquid oxygen. It becomes a gas as it's released from the tank, and it's warmed up by the time it reaches the chamber. They can also control the temperature inside, so if it's too warm or too cool, they can adjust it. The whole process takes about 90 minutes, or as I learned, 2 episodes of Deep Space Nine. I also learned that to have the best results, you need to plan on repeat visits.
For diabetic foot ulcers, most of the research has shown that it takes between about 20 and 40 to really get a good effect for diabetic injury, diabetic ulcers. That varies obviously due to the severity of the injury, the depth, the amount of infection, and the amount of tissue that you lose when you have surgery or an infection.
And you'll enjoy coming back, as I did. After a while, you get to be good friends. I'm Dan Bomas.